As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
All right, joining me now, welcome back to Your Health with Terrebonne General Medical Center. I'm Martin Falls. We have some guests from Terrebonne General. Let's take a look. There you see Dr. Irving Blatt on the left, and of course, otolaryngology. Big word, but he'll explain exactly what it means. Ear, nose, and throat, diseases of the hearing, and things of that sort. And then there's Mimi Brooks, right on his side, and she is an audiologist. And I want to welcome both of you on tonight. Thanks for coming.
Thank you.
Welcome. Thank you for having us.
Thank you.
All right, now, dizziness ranks among the most common reasons why adults visit the doctor. And I always want to ask this question because sometimes I get dizzy and sometimes I have vertigo. So, Dr. Blatt, you get diagnosed different ways, but what's the difference for people watching tonight?
Dizziness describes everything from feeling faint or lightheaded to feeling weak or losing balance.
Okay.
Vertigo is a kind of dizziness that creates a sense that you or your surroundings are spinning or moving.
Okay, all right, very good. Now, Mimi, I'll come to you. What causes dizziness?
Well, there's several possible causes of dizziness, but then you have to kind of go back to what a person is expressing. So a person who says, I'm feeling kind of faint. Okay, that can be anything from a drop in blood pressure to a drop in blood sugar. It could be dehydration, or it could be fatigue. So for people feeling faint, you have a couple of different reasons depending on how they describe it. For someone who says, I have a loss of balance when I'm walking, this can be an inner ear problem. It can also be a sensory disorder like neuropathy or something where you've lost feeling in limbs, or it can actually be from joint and muscle problems that you're experiencing. And then the last thing is that sensation of floating or swimming that some people have, and this can be medications that can cause this. It can be inner ear problems that cause this, and some anxiety disorders actually cause it too.
All right, very good explanation. Now, that was the cause of dizziness. So, Dr. Blatt, I'm gonna ask you the causes for vertigo. What are they?
There are several possible causes of vertigo or the spinning. One is called the scientific term of benign positional paroxysmal vertigo, or a BPPV. And that is about 50% of the cause of dizziness from the ear. And this has to do with small calcium crystals of the inner ear that have become displaced. Another cause of vertigo is ear infection. Ear infections that can be caused by either a virus or a bacteria. Then there's a condition that's got a name called Meniere's disease, and that's a sodium salt imbalance and a fluid imbalance that causes increased fluid in the inner ear. And in the Meniere's disease, spinning vertigo can last anywhere from minutes to hours. There can also be some migraine headaches that are associated with vertigo.
All right. Well, Dr. Blatt, let me ask you, some people sometimes say they feel like they're losing their balance, and we've had it before, I've had it before. But what controls your balance?
To answer your question, I was also, for the last question, there is a benign tumor that can also be responsible for vertigo that has to do with the control of the nerve of balance in the inner ear. Relative to what controls balance, there are the body uses three systems to control balance: your eyes, your ears, and your legs. And it also has a central processor that is found in a part of the brain called the cerebellum. Now, when one of these systems don't work, you begin to have trouble with balance or equilibrium. Your eyes control your visual fields and the perception of depth. Your ears tell you your position your body is in, whether you're moving or standing, still or laying down. And finally, your legs give you a sense of gravity.
Okay, very good. Now, Mimi, dizziness or vertigo, can that be a sign in somebody that there's something more serious around the corner?
Dizziness is a general term that it's the most common reason adults go to the doctor. I'm dizzy. It's just a general blanket term. And so then the next thing you have to say is the dizziness interfering with your daily activities? You know, it's those kind of dizziness, not life-threatening. But whenever you have dizziness, vertigo, and a combination of other symptoms, then it's very advised to see a doctor, you know.
Okay, very good. We're going to take a break. We're going to come back, and we're going to have some graphics up, you know, when you should visit a doctor and that kind of thing. So let's take a break, hear from Terrebonne General Medical Center, and we'll be right back with Dr. Blatt and also Mimi Brooks. Don't go away.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
My husband and I have known each other since high school, and Bobby and I are very close. When I started losing my hair during my cancer treatment, he volunteered to shave his head too. My name is Sherry Starkey, and in 2007, I was treated for breast cancer at Mary Bird Perkins. 2 different doctors recommended Mary Bird Perkins, and everybody there was fantastic. And I know being close to home and family really helped a lot too. I'm still here, and Mary Bird Perkins had a lot to do with that.
Mary Bird Perkins Cancer Center at TGMC.
And welcome back to Your Health with Terrebonne General Medical Center. I'm Martin Falls. We're talking with Dr. Irving Blatt, and we're talking about Mimi Brooks. We're talking about dizziness and vertigo and everything that goes with it. And, of course, Dr. Blatt deals with ENT. He deals with diseases of hearing and specialties of that nature. And Mimi's an audiologist. And, well, this is we were talking a lot during the break, but we'll get back to the topic because it's very interesting stuff. But when we're talking about dizziness and vertigo, and Dr. Blatt, I'll ask you this. When do people decide, or when should they go visit a doctor on this?
One should consult a physician or doctor if they have frequent spells of dizziness or vertigo, severe or worsening dizziness, new dizziness with no apparent cause. If dizziness is accompanied by certain conditions such as head injury, a severe headache, fever, a stiff neck, blurred vision, hearing loss, speech impairment, weakness in the arms or legs, loss of consciousness, falling, difficulty walking, chest pain, or rapid or slowing of the heart rate, and a facial droop or slurred speech.
Okay. Now, how does one, if they go and see you, Dr. Blatt, and they're watching tonight, and of course a lot of people like to prepare before they go see the doctor. How do they prepare when they go see?
Well, hopefully we would want the patient to write down how frequently they're dizzy, or try to remember that. They need to bring a list, or preferably their current medication bottles with them, so that the doctor can see exactly what bottles may be duplicated or whether or not this is a medicine that may cause a vertigo or dizziness. And you need to let your doctor know if there are other symptoms in addition to the dizziness, like chest pain, trouble breathing, feel an abnormal heartbeat in the chest.
Okay. Now, what are the treatments themselves? Somebody comes to you and they're officially dizzy or whatever. I mean, what's the kind of treatments you put them on?
Well, we said that 50% of dizziness that is caused by the ear is benign postural positional vertigo, which is this inner ear crystal situation, which tells you if you're upside down, right side up, or moving, or staying, sitting, or standing, or laying still. And so these can be treated by inner ear crystal repositioning. And this is really a simple procedure where the position of your head is maneuvered by the audiologist, for example, or other caregiver that is treating. And this is usually effective after 2 to 3 treatments. However, they're at best 80% successful.
Okay. Not a bad percentage. Yeah, I like that. Now, Mimi, I guess the whole idea of dizziness too is properly identifying dizziness in its own respect. And what options do you have to identify dizziness?
Well, I think the first thing you should do is, because dizziness is your perception of how you feel and you describe it different ways, is to basically have a medical professional who understands dizziness, understands what causes dizziness and vertigo, and have a very good dialect with them to begin your treatment, you know. And then with well-defined test protocols, which we have now that we didn't have in the past, such as testing audiologists perform, which is VNG testing. This can help locate where a problem is breaking down in the vestibular system. And then diagnostic imaging and laboratory tests that the physician can order. Combining those are key in making a diagnosis. I guess the biggest thing is now you have options, where before it was kind of like, we don't know why you're dizzy and good luck. You know, now we have some great tools to help identify it, and then some great treatment methods to help alleviate it, which are important in getting back to your everyday life.
I want to thank y'all for coming, because I got to tell you, all the medical things I've done, I hear people say they're dizzy. And I knew what vertigo was because I heard people when I was young saying, I got vertigo. Okay, and what's vertigo? But when you get vertigo, you know doggone good well what it is at that point. But thank y'all for coming by, and we appreciate it. And come back. We'd love to see you again.
Thanks for having us.
All right, we're going to take a short break. When we come back, we're going in the Canada's kitchen, and Chef George and Joni Petrie is going to tell us what they have today, and I'm sure it's something good as usual. We'll be right back.